Hi, I'm Dr. Smith. Since many patients have concerns about what their healthcare will cost, I'd like to share with you some ways you can manage these costs. I'll help you understand what you should ask your physician or the office when you have an appointment, what you can look up yourself to help control how much you pay for your care, and when you should contact your insurance company. You visit your physician's office when you need treatment for a medical condition or to check up on your health. Usually, the most important thing on your mind is to get answers or feel better. Increasingly, though, patients like you are worrying about the costs of their care, not just the copays that might be required, but also medicines, tests, and even costs like getting to appointments or having to pay for childcare while you go to the doctor. You wonder how much or even if your insurance will cover the costs, and if you can afford the other costs related to your care like missing work. The first thing you should know is that it's okay to ask. Whenever you're concerned about the cost of something your doctor mentions, you should be sure to ask. Find out exactly what's required for your treatment. If you need blood tests, ask which ones. If you need imaging, find out if it's an X-ray, MRI, or something else. Ask your doctor to give the specific kinds of treatments, blood work, or imaging you need so that you can see what's covered by your insurance and what you might have to pay out of pocket. Ask where you'll need to go for these tests or imaging so you can account for the costs to get there, such as bus fare or parking fees. Find out how long these things may take and how often you'll need to do them so you can think about other possible costs like childcare or time off from work. All of these things figure into the total cost of your health care and are important to know at the beginning so that you and your doctor can make a health care plan that you can actually follow. Once you have checked with your insurance provider, if you have one, about what's covered and you have added up all the likely costs of your care, ask your doctor what you can do if you don't think you can afford the treatment prescribed. There are actually many resources available to help patients. For instance, if you don't currently have insurance, you might be eligible for government insurance such as Medicaid. There are also ways to help cover or lower prescription costs. You can shop around various pharmacies to compare costs. Places like Walmart and Costco are often less expensive than other pharmacies. There are some online cost comparison sites, such as GoodRx.com, that let you compare prices locally. You can consider 90-day refills, mail prescriptions, and generic products, which may all be lower in cost. Many of the drug companies have patient assistance programs for the drugs they make, and some states and communities have local programs that help with drug costs. Finally, there are also resources to help patients with copays, insurance premiums, transportation, and even food. Some are condition-specific, but many are not. The most important message I can leave you with is, don't be afraid to talk with your doctor if you're worried about how much treatment will cost. Both you and your doctor want you to get better. Stopping treatment because of costs might not be good for you. Your doctor often has options for your treatment and can help you find assistance when it's needed. So talk with your physicians about all of these questions because you and your doctor are a team, and together you can achieve better health.